Michelle, I am so glad I ran into you. How are things in El Paso with that innovative new curriculum? I heard the LCME loved it when they were there last month on their site visit.
Robert. Good morning. The best thing about APGO meetings is that I get to see all my old friends. El Paso is fine and the excitement about the little medical school on the border is totally palpable. So much need and so much opportunity for innovation. How about you over in Lubbock?
Well, I really wanted to get your opinion and help. It seems my medical students and residents are really frustrated with the level of breastfeeding amongst our patients. We talk about it in clinic and encourage them after delivery, but by the time they come back postpartum, very few of them are still trying to breastfeed exclusively and some just give up.
We seem to have the same problem in El Paso. And it is worsened by the language barrier.
I've looked into it a bit and it may stem from a basic lack of understanding on the part of our students and residents.
Well, we have a set curriculum and yet it seems they either don't grasp the basic concepts like avoiding supplementation or they just are not relating it well to the patients. By the way, have you heard of Los Dos?
Los Dos?
Yes, here on the border. Anyway, new mothers give the two methods. Seems to be a cultural practice. And the poor babies and moms get so confused by using both bottle and breast from birth that the continuation rates are dismal. It is a perfect point for our students to demonstrate their knowledge of the physiology of breastfeeding when talking to new moms on rounds. I am just not convinced they can really apply it to the patient care setting.
I know what you mean. You would think that supply and demand refer to advanced economic theory. We could use a longitudinal curriculum that started early in medical school and went through residency.
We need something portable so we can involve our community preceptors. Many of them are very interested but essentially had very limited exposure in medical school or residency. It would be really nice to make it interprofessional so we have a unified front. They should spend some time with a lactation consultant as well as with one of the community-based lactation support services.
Well, let's work on something together for both campuses.
In English and Spanish?
Claro que sí. Of course. I think the platform has to be online so as to offer easy access.
I knew you would say that. You always have your iPad with you.
How about an iBook format?
That would be even better. That way you don't have to be online all the time. It also offers the opportunity to add illustrations and video.
I think it would be fantastic if the same teaching tools we use for the learners could be modified for the patients. You know, replace the medical terms with plain English or Spanish.
That way the student is more likely to convey the correct message. And we could use those tools as part of the way to assess them as well.
You know, Michelle, I saw that APGO has a special 50th anniversary grant opportunity. They require a curriculum that serves to address a national and international women's health issue.
Yes. I saw that too. Those projects need an electronic educational component that can be used by the APGO membership to improve women's health care within underserved communities in the United States and Canada, and also be easily adapted for use internationally.
Amazing. That is just what we were talking about the other day. And we have the benefit of the border location to pilot it not only in English but in Spanish.
And this is really exciting. Breastfeeding has to be one of the most important and pervasive women's health issues of our time. The Surgeon General issued a call to action just last year and targeted the lack of consistent education for healthcare professionals as one of the major barriers to continuation of breastfeeding.
I know. According to the CDC's most recent report card, 75% of mothers in the U.S. start out breastfeeding, but by the end of 6 months, breastfeeding rates fall to 43%, and only 13% of babies are exclusively breastfed. And like you said, it is even worse there on the border because of Los Dos.
And this is a global women's health issue.
Yes. I read where breastfeeding was identified as a major concern in the declaration of the World Summit for Children, an international conference on nutrition sponsored by the World Health Organization.
And bringing it close to home here on the border, the Pan American Health Organization has developed a regional plan of action aimed at helping to bring down the high prevalence of malnutrition in the region. A priority for the next 3 years is to design a pilot program to promote exclusive breastfeeding for the first 4 to 6 months of life that will eventually be rolled out to the entire region of the Americas.
Wow. You know that more than 80% of the region is either English or Spanish speaking. Our idea of using our schools and capitalizing on the proximity to Mexico to create a bilingual focus for our project is spot on.
We should have no problem piloting it in both languages, and when APGO distributes it, it will already meet a huge need for medical educators, students and practitioners throughout the region.
Well, Michelle, you know what we learned at APGO Scholars. We can't forget the assessment part of our curriculum, and our proposal is very forward-thinking because we built in not only assessment of the educational content but also our using the iBook platform. I think you will bring a lot of expertise to this project because of your experience developing the iBreast iPad app.
I have to say, Robert, that you have special skills and knowledge as well that will make this project amazing. Didn't you set up the basic medical Spanish course at Texas Tech? All online, with dozens of video, and a final OSCE in Spanish?
I think we are a great team, and by the time we recruit a couple of residents and medical students interested in promoting breastfeeding under the auspices of this grant, we will be able to meet all the deadlines they have outlined in the RFP.
That's why I love working with you, Robert.
Same here. Now let's get busy and get this thing submitted so all target audiences can get a big win from our effort.